My name is Angie Buonassisi. I'm one of the co-founders of 8 West Cosmetic Surgery and Skin Clinic. Thank you for joining us on Thursday. We hope we're giving you a little bit of a break from your day, whether you're working from home or working from the office. We planned it at lunchtime. We hope that helps. We hope that works for you. Today we have a really interesting topic to cover. We're planning to cover lots of topics in this live format in the future. And today we're going to be talking about CoolSculpting, which is a really great non-surgical way to permanently destroy fat cells. So let me just go over a quick agenda of what we're going to be covering. First of all, we're going to hear from Sonya, who is our registered nurse and master CoolSculpting technician. She's going to talk to you about the Body Beautiful program, a really great program and special package that we've put together in collaboration with some health and wellness partners in our neighborhood to really help you achieve your goals. Then we're going to look at and sort of find out more about the way that we provide CoolSculpting at the clinic, which is quite unique. Then we're going to hear from some real patients who are going to be joining us live today virtually to tell us about their experience. The agenda went away, so I'm just going to quickly pull up my notes here again. So we talked about this is the nature of going live, so thank you for bearing with us. So the patient journey, then we're going to do an audience Q&A. So if you have any questions, please don't hesitate. Sonya's going to answer them all for you. And then we're going to end with like an in-depth dive into the Be Body Beautiful program that we've come up with for you. So without further ado, I'd like to introduce you to Sonya. Hello, Sonya.
Oh, hello.
Sonya, so as I said, is a registered nurse here at the clinic, core part of our team, one of our master trained CoolSculpting specialists, along with Suzanne Power, who we know you all know and love. Sonya, can you tell us more about the Body Beautiful program?
Yeah, so it's a great program we put together. And so not only does it have great pricing, so each individual cycle is 20% off, which is a great deal. But then we also have an additional 10% off packages. And then the Be Body Beautiful program. So with each purchase, you'll get a $150 gift card to a personal training at InfoFit, 2-for-1 infrared session at Shrink Wrap, first meal free by Inspired Go, which is a great salad delivery company. And then each one also comes with an Aura Inner Beauty probiotic or collagen, and then a delicious body butter or a scrub. So lots of goodies. It's always nice to walk away with not only, and they all are like tailored for your CoolSculpting experience.
That is great. What an amazing package. And I know that I personally have trained with InfoFit. They're very close to us here, and they're absolutely amazing and top notch as personal trainers. So really excited to have them as part of this package. Sonya, I wanted to talk to you a little bit about our unique approach to CoolSculpting at the clinic. And I was wondering if you could start off by explaining what it means to be master trained.
So master trained, so not only do you have to attend CoolSculpting University to get the initial, like how to do CoolSculpting, but then you also have to do a certain number of treatments. And once you've done those certain number of treatments, then you actually are eligible to go to the master trained, which then you get to meet people from all across the country who also give tips and tricks about how to CoolSculpting. And yeah, I think it's just like a build confidence with CoolSculpting. Like I go into a consult and I'm very honest, very realistic. And just like you're sculpting somebody's body, and I think it's such a cool treatment.
That's great. Yes, and I know that you do really love this treatment, and you do have such great confidence because of the sheer number of treatments that you've performed. So let's talk more about, let's go into detail a little bit about how the CoolSculpting technology actually works. I think we have a video.
Okay. So yeah.
All right.
CoolSculpting works. It works with cryolipolysis, which is when the applicators get put on, they actually bring this fat cells down to anywhere from -11 to -13. And that causes the fat cell to go into a state of basically self-destruction. So over the next 2 weeks, your body will swell, white blood cells come in, they see the dead fat cell, and then over the next 2 to 3 to even 4 months, your body just flushes it out through the lymphatic system.
Wow, so that's amazing.
So no harm to the skin. We just target fat cells, and that's pretty cool that they can do that with CoolSculpting.
Okay, wonderful. So let's cover a couple of things. So, for example, who is a candidate for CoolSculpting?
So somebody great for CoolSculpting is usually within like 30 pounds of their goal weight. They've tried basically everything, and they have like a stubborn pocket. They're like, no matter how much I lose or if I gain, or it's just I've tried everything and it won't go, that's like perfect for CoolSculpting because we can just basically shave those off. So areas we treat are anywhere like under the chin, the little bra fat area, arms are another really big one. Everyone has the lower abs, upper abs, you have flanks as well, inner thighs, and above the knees. Outer thighs actually as well too. If I can pinch it, I can CoolSculpt it.
All right. So it is, that leads me to my next question. So is it appropriate for somebody who is already very, very slim? Like an athlete, for example, wanting to really, really tone down.
So I think it's at that point. So somebody who has like a pocket this big that they want to get rid of, you can expect a 25% reduction. So it's going to seem like a lot because they have a lot to work with. Whereas if you're quite small and you want to lose 20 to 25% of that, it's just setting realistic expectations. It may not be visible in photos, but it's definitely in what you can pinch. And then sometimes it also is great in photos. So just being realistic with it. But yeah, any shape and size is good for CoolSculpting.
Okay, so on the topic of being realistic, because I know that one of the things we're really, really important to us at the clinic is providing really great recommendations and unbiased advice about our treatments. Is there anybody that isn't going to benefit from CoolSculpting?
So there is a few contraindications. So anyone who's pregnant, anyone who has a hernia, there's also a few like disorders that we can't treat. So anything that has like, it's a disease that makes your red blood cells sensitive to the cold, that's not a good candidate. But also you want to be careful with like lax skin. Sometimes I've found and experienced that the skin, when you take away the fat, may appear more loose. So not all the time. And it's just setting realistic expectations that may happen, that may not. We just want to cover that.
Right. And I know that Sonya covers all of that in her assessment. And that's a good time to mention that a CoolSculpting consultation with Sonya is complimentary. So it really is a great chance to come in and meet her because she's as lovely in person as she is on the show here. And she'll give you a very realistic assessment about what is going to work for you and what you should expect in terms of cycles. Would this be a good time for us to hear from a real patient? I think it is. I'd like to introduce you to Mitch. Hi, Mitch.
Hey, guys.
We know and love Mitch because he's a part of the marketing team here. And he also, he recently has been having some CoolSculpting treatments with Sonya. So he was very happy to share his journey with us. So Mitch, hi. What can you tell us about your CoolSculpting experience?
Absolutely. So yeah, I started it probably in November last year with Sonya. And it was when I first joined the clinic and I was looking at all the treatments that we have. And getting really excited that that I get to work in this place with so much amazing treatments and stuff that we have here. And one thing that I've always been really self-conscious of myself is my submental chin jawline area. It's something that not many people notice, but I always notice in the mirror, and it's something that I just have not been able to get rid of. I will exercise. I'm quite a fit person. I'm a dancer. I like to snowboard. I do fluctuate in weight. But even when I'm at my fittest or, a few, pounds, 20, 30 pounds more than I would like to be, it doesn't change. Regardless of that little bit under my chin will just remain there. And I just didn't understand why. And I would always just see it in the mirror and it would always make me feel a bit larger than I was. And it kind of really didn't fit with the image that I had about how I was and how I looked. So that's when I talked to Sonya about Belkyra, which is an injectable treatment at the clinic. And then Sonya said, actually, I think you'd be a really great candidate for CoolSculpting.
Yeah, so I feel like we had this conversation about how this area just won't budge for him and he's like tried to lose weight. It's really hard to try to like lose weight under the chin. Like there's no exercise for that basically. And so, yeah, he asked about Belkyra, but I personally, if I can use CoolSculpting, it's a great tool because it does a really great job of getting rid of like most of it. And then if at the end there's a little bit left, I can always fine tune it with Belkyra. But if I have the choice, I'd like to do CoolSculpting first.
Right. Well, that's great. So Mitch, tell us more about like, what did it feel like having the treatment?
Of course. So Sonya did take me a bit through what to expect, but of course, you kind of get told so much and to experience it yourself. I wasn't too nervous, and those expectations were kind of even throughout it. It wasn't a painful experience for me. It was a bit uncomfortable, and there's a really flattering video of me right there. So yeah, that essentially, Sonya described it as like a hickey machine.
Yeah.
So it kind of sucked on to the neck there, and then it freezes the fat to 11, 13 below freezing, which is insane. And it feels a bit uncomfortable for the first 10 minutes while it's freezing the area, and then it just goes numb. You don't feel a thing, and I had a nap. So
You must have been very tired that day, Mitch.
yeah, very relaxed, weirdly enough, as something was attached to my chin.
And tell us about after, any downtime, any side effects?
Yeah, so for the week after, Sonya gave me some what to expect. She maybe some swelling and some bruising, a bit of pain and discomfort. I didn't personally notice much bruising in the area. It definitely was swollen, and it kind of just felt like you had this weird solid piece under your chin. You couldn't feel it. It was completely numb. It just felt a bit odd. So that lasted about a week, maybe up to 10 days. And then just to kind of feel a bit less of the firmness and the numbness. And so that was the downtime. It wasn't too discomfort. It wasn't too much it wasn't too uncomfortable. It felt fine. It subsided. And the actual look of it only lasted probably like a week max in terms of it looks a little bit fuller. And yeah, I've definitely noticed some results throughout the period. I noticed my results probably at the 2-month mark, and then I've noticed it more so and more so.
Okay, so Sonya, what does Mitch's treatment plan look like in terms of timing and cycles, etc.?
Yeah, so for Mitch, I was able to do 3 on the first round, so 1 right in the center and then 2 off on the side. I did wait till the 2-month mark or 2.5 to retreat. So peak results are usually at 2 months, but they continue to show results for about another 2 months, so 4 months in total. So we retreated at the 2-month mark, and we did 2 actually. So smaller size, and we only needed 2 for the next one. And that probably took, an hour and a half, 2 hours to do. And yeah, in his second round, and we'll see. I feel like the next one will either be like 1 right in the middle, or Belkyra, or maybe we're just done.
Yeah, I'm looking forward to seeing the results. It was about 3 weeks ago that my second treatment happened, so I'm looking forward to now I'll start to hopefully see results in the next month or so.
And I feel like he had a mass, so like no one I think even knew you had CoolSculpting.
Yeah, until like one day I think you walked past me having lunch, or I was taking a sip of water, and you're like, oh wow, like you're almost ready for your next cycle. Let's take after photos, Mitch. Like,
yeah,
it was a surprise to even me. It's good to have that kind of third party take a look and notice the big difference. It was quite nice to
yeah, I can see you from all angles, so definitely. No, we were just talking about what it looks like after a CoolSculpting treatment. Is Sarah around by any chance? Because I know she had just had her abdomen treated today. Is she there? She said she'd be willing to show everyone her stomach, so would love to. Thank you, Sarah.
Yeah, let me see if I can grab her.
Okay. And while we're looking for Sarah, Mitch, were you asked to shave your facial hair for the treatment, or is that not necessary?
Yes. So that was something I had to do at the beginning for both of my treatments, because the applicator needed to actually have the full suction and none of the potential slip, because the suction can pop off, and it doesn't usually, but you want to try and reduce that as much as you can, from what I understand. So I had to shave each time, which
right.
But yeah, I had to shave both of those times. So it's, I guess, only men usually will have to have that problem, I imagine, in terms of having to shave anything for that submental area.
Yeah, exactly.
Stomach too. If there is a lot of hair, I'll try to ask the patient to shave, because the hair can cause a little bit more, like it's easier to slip off, and like definitely harder with the submental if they're not shaven. So shaving is, I mean, I want the best results for you, so if it means shaving, unfortunately, it goes.
Yeah. Probably a downside. Okay, great. So we've got Sarah.
Hello.
Hi, Sarah. So Sarah is so well loved by everybody that's ever worked with patients. Anybody that's ever worked with Sarah knows how amazing she is. She's Dr. Buonassisi's patient care manager. So she is the one that actually ensures a very smooth and happy surgical process for all of his surgery patients. She has had she's just had a treatment today on her abdomen, and we wanted to show you. Sarah, why don't you show us? So this is like, how long ago was the treatment completed?
It was completed about 30 minutes ago, so it's still
okay.
I did a few more treatments 2 days ago. And so I'm a little bit sore and a little bit bloated, but it's not too bad. And I feel
Okay.
eat in the morning.
So what does it feel like right now? Is it still cold? Is your skin cold?
So about, no, my skin's not cold anymore. It's kind of just, it's just normal temperature.
Is this really normal again? Okay. Okay, great. What do you think so far about your CoolSculpting, Sarah?
Yeah, I'm excited. I did have like quite a bit of volume. So the first treatment that we did um, I think about 10 cycles, just to kind of debulk everything. I have noticed a difference. You can't really see the difference, but for example, these pants here.
Yep.
Yeah.
Wow.
It's like
Wow.
I think we need those now.
So it's definitely like a little bit softer, and like my pants are just fitting better. And then I think after the second treatment, like we'll actually start like other people will see the results and not just me.
Great. Thank you, Sarah. We really appreciate you sharing. Thank you so much. Sonya, if there's anything covering your mic, will you let us know? Your sound isn't awesome, but if there's nothing covering it, not to worry. We'll just do our best. This is live. This is live.
Is that better? I think it might have been a piece of paper.
It actually does sound better, yes.
Okay.
Okay, great. So Sarah had just been talking about, debulking. And so can you tell us a little bit more about the various types of applicators that are used?
Yeah, so there's 5 different applicators. There is the smallest one, which is the mini, which goes under usually the submental. It can also go on the bra fat area. It can go above the knee. Honestly, lower abs if you're a really petite person. There's also a petite, which is slightly larger, but still in the petite family. Then there's the Cool Advantage, which is probably the most commonly used one. It's great for around the stomach, great for flanks. It's about this big. The next is the Plus, which is twice as big as the Advantage. And then we have a Smooth. So this is the only non-vacuum applicator, and it's a flat panel that I feel like was typically used for the outer thighs, but I love it for any fibrous area. So flanks as well. I feel like lower abs also, upper abs as well. It's a very versatile applicator.
Okay, interesting. Yeah, the technology itself is quite amazing. I think we've covered some great stuff, and we'd love to take questions. If there's anybody watching the show that has any questions at all, please bring them on. This is your chance to connect with Sonya, who is a super pro at this treatment, has done many of them. And while the questions are coming through, I can ask questions as well, because I have so many. Are there any types of fat that you can't treat with CoolSculpting?
So yes, it is visceral fat. So unfortunately, when a male comes in and he's got kind of like that beer belly, that's visceral fat. So fat that is above muscle, so something I can pinch, is treatable with CoolSculpting. Fat that is below the muscle is visceral fat, and unfortunately, you can't treat that with CoolSculpting or even liposuction. That's strictly a diet and exercise only way to lose that.
Okay, all right. Here's a question. Is CoolSculpting permanent?
It is. So it's a permanent way of reducing fat cells. So you're born with a certain number of fat cells. They shrink and expand as we gain and lose weight. But when CoolSculpting attacks those fat cells and kills them, they are gone forever. It's not until you become morbidly obese that your fat cells actually divide, which no one is going to go there. But I've actually seen it where somebody in 3 months unfortunately gained about 30 pounds, and I could still see where the CoolSculpting applicators were placed. So just basically showing that those fat cells are permanently gone.
Okay, great. Okay. Now, we had been talking earlier about contraindications. I know we have this question now. What about if you're pregnant or breastfeeding?
So Allergan asks, definitely no for pregnancy. We also have said no to breastfeeding in the fact that fat cells get flushed through your lymphatic system, and that does in return mean breast milk. And it is a process of over 2 months that you're constantly putting fat cells in through your lymphatic system. So you also have a fluctuation of weight and hormones during that period. So it's not the most beneficial for you to be doing it while you're pregnant or breastfeeding.
Okay. All right. And what are some of the other typical questions that you get from people, Sonya?
I feel like main one is like, does it hurt? And I say the first part feels cold. It feels like an ice block is basically on you. 10 minutes later, it goes numb. And then, like Mitch said, he fell asleep. I notoriously will fall asleep during my treatments too. I think it's like the hum of the machine puts you to sleep. And then it's the dreaded massage at the very end. So we need to do a massage to help break apart those fat cells and cause a little bit of shock to them. And yeah, I feel like that's anywhere from like a short, while I'm doing the massage, it hurts, and it can linger for about 5 to 10 minutes after, or you're numb and you just really don't feel anything. Mm-hmm. So I'm honest with that question.
Okay. And I do know that it's extremely well tolerated by everyone. It probably sounds worse than it is. Okay. So let's finish up then with doing a review of in-depth dive into the Be Body Beautiful program.
Yeah, so we discussed the great perks, which include the pricing and then the gift with each purchase, which is, I feel like no other clinic does. I really like supporting local businesses, so we've teamed up with a lot of great people. But then we also have a grand prize draw, and we actually have 2 of them, so that's kind of cool. So if you book your consult, so all you need to do is between April 19th to May 31st, at least have your consult scheduled, even though it's maybe before or after May 31st, you get entered into this draw. So for every 2 cycles, you'll get 1 entry in, and that includes 2 free CoolSculpting cycles, which is a value upwards of $3,000. An 8 West medical skincare basket valued at about $500. You get a signature hydrofacial valued at $175, and then Inspired Go is donating a $100 gift card to their great services. And then finally, Shrink Wrap is also doing a $100 gift card. Oh, and I think, well, with every purchase, you get $150 at InfoFit. So that's with everyone.
Great. That is such an amazing package, and I can say that this is something that we don't do very, very often. So it's a great time to take advantage of something like this. If you go to our Instagram bio, there is a link that will take you straight to the page where you can indicate your interest in this program and just sign up on the form. And one of our lovely educators here will give you a call and arrange your complimentary consultation with Sonya. So we want to say thank you very much. And I also want to say thank you to my team for putting together this great live show. I'm just so excited about this. And I think the small little hiccups, but I think it was okay, wasn't it? Thank you very much. And we hope to see you next time. Take care. Bye. Bye.